I'm Dr. Samantha. I'm a naturopathic doctor that specializes in hormone health and fertility care. And today we're going to talk about signs of implantation bleeding and how it differs from spotting before your period. Okay, so welcome back to another video. I'm super excited to chat about this because I actually get a ton of questions about spotting during the 2-week wait. So first off, I like to always tell people we need to learn how to track. How do we know we're in our 2-week wait? How do we know we ovulated? All of that good stuff. I do have a lot of resources on learning how to track, so check that out. It is a free guide, so all you have to do is put your email in there and you'll get all my favorite tips and tricks on how to track and know that you are ovulating. But for sake of time, and since it's really not the purpose of this video, let's just do a really quick recap. So most people, or they say majority of cycles, are about 28 days long. They can vary, they can be a little shorter, a little bit longer, but let's just use that 28-day marker since that tends to be the most common. The first half of the cycle is the follicular phase, the second half of the cycle is the luteal phase, and we do have ovulation somewhere in the middle there. Tends to be around day 14, 15, 16 for many people. Ovulation day is the day where your egg is released, and that is when sperm can meet egg to form an embryo. Usually this happens in the fallopian tube. The embryo then comes down and implants in the uterus. That's what should happen, right? Obviously, there are things like ectopic pregnancies that can occur, which means essentially the embryo has implanted in your fallopian tube, and that can cause a lot of medical issues or distress. So if that does happen to you or you have a history with those, this is just kind of a reminder to just make sure that it's checked out. To rule it out, you have to kind of talk to your practitioner, get HCG levels done, and maybe some imaging as well. But on that note, kind of went off on a tangent there for a little bit, but long story short, I'm just kind of explaining the cycle to you and what happens. To track ovulation, a lot of people track with basal body temperature, they track with cervical mucus, and they really like to use those apps nowadays, Natural Cycles, Temp Drop, and so on. Again, just check out that free resource. You'll get a lot more details on actually how to track ovulation. So let's go back to where sperm meets egg. Once they meet in the fallopian tube, they travel all the way down and implant in the uterine lining. Sometimes that implantation can cause some of the endometrium to slough off, causing some spotting. Now, how do you know if this is period spotting or if this is implantation bleeding? That's the question that I'm hopefully going to answer for you today. So the most annoying answer is ultimately you're gonna have to wait. You'll have to wait to see if later on you get a positive pregnancy test, then you obviously know if it's spotting or implantation bleeding. With that being said though, there are some signs that you can look out for that will more so sway you towards implantation bleeding, and I'm about to list them right now. So there's about 6 signs that we're gonna look out for. The first one is going to be that implantation bleeding usually starts 6 to 10 days after your predicted ovulation. Normal period bleeding usually starts 14 days after ovulation. So essentially implantation bleeding starts a little sooner. Sometimes period bleeding can start around 10 days after luteal phase. If you have been tracking your cycle, you'll probably be able to know what is the usual timeline when it comes to your period and bleeding. That's just kind of another reason why it can be nice to track your cycle at least for a little bit so you can get to know your body and what your menstrual cycle really looks like. Number 2 is going to be the color. So where period blood, even spotting, tends to be more reddish, brownish tints, implantation bleeding tends to be a light pink. Number 3 is going to be the consistency. Normally implantation bleeding is very light, has a very thin water-like consistency, when period blood or period spotting tends to be a little bit heavier, which leads into number 4, where if there's clotting, normally we can associate that with period. There's usually not a lot of clotting with implantation bleeding. Number 5, light cramping. It can feel like little twinges. Some people can feel a slight cramp when they ovulate. Sometimes it can feel also close to that, maybe more so in the uterine area, so a little bit lower than you might normally experience that pain, but it should be very, very light and mild compared to most cramps. Or if you normally don't have cramps and you feel that, that could also be a sign. And last but not least, the timeline. The bleeding will last about 1 to 3 days, which is going to be shorter than a period. If you do spot before your period, I also want to just do a little plug here that might not be ideal. Usually spotting after your period is going to be a-okay, but I really like a period to start with a heavier flow in the beginning, not like this trickle up spotting. So just like I said, a little plug, if that's occurring for you, I actually usually recommend checking your hormones, making sure those are all balanced. We don't necessarily want spotting before the period actually starts. So again, these are just some tips and tricks for you to be able to distinguish implantation bleeding before spotting or a period. I hope this was really helpful to you. If you learned something new today, please give this video a thumbs up. Don't forget to subscribe to my channel. A new video comes out every Friday, and I hope you have a beautiful rest of your day.